Welcome to From the Clinic to the Courtroom, Health Law Unpacked.
Hello and welcome to From the Clinic to the Courtroom, Health Law Unpacked with Maria T. Santi Esquire, founder and managing partner of the Health and Medicine Law Firm. Maria and the team are focused on providing exceptional legal services with efficiency, accuracy, attention to detail, and a high work ethic. I am your host, Kevin Rosenquist, and today's episode is When It's Your Child, Fighting Insurance for Pediatric and Newborn Care. Maria, welcome back. Great to see you.
Thank you. Great to see you too.
So tell me, what are some of the most common insurance denials that parents face when seeking medical care, specifically for their newborns?
So what happens very often with newborn care is during the process where a newborn gets added to a health insurance policy. I represent many parents that go through these issues where they add the newborn to either parent's policy or just to one parent's policy, or they don't add them. And then the health insurance company will look for different technicalities on how to deny claims for that newborn. It might be that they say, well, this parent had insurance, so for the first 30 days, typically, they have to cover the services that are provided to the newborns because the newborn automatically falls under the parent that has the health insurance policy. So they just get into nuances and technicalities. A lot of things I see also when the parents may call, if they have an Affordable Care Act plan and they call the marketplace to add the newborn, then at that point, the marketplace for some reason disenrolls the parent and then adds the newborn. And it creates a lot of administrative issues. And that seems to be a miscommunication that happens very often between the health insurance companies and the marketplace. And then what ends up happening, the parent didn't have insurance, then the newborn doesn't get insurance, and it just becomes an administrative mess. That's something that I think legislation will have to fix later on. But unfortunately, it's something I have had to litigate a few times because it does happen very often. So definitely parents need to be on the lookout for that and make sure that the marketplace is keeping both the newborn and the parents on the policy if they are adding under a marketplace policy.
That's crazy, right? I mean, technology is so good these days. How can that happen? I don't understand.
Yeah, I really think it's miscommunication. And then the health insurance company is supposed to give notice if they're canceling somebody, but they don't. They just say it's the marketplace's fault. Okay. And then they're just pointing fingers. Like, yeah, technology doesn't seem to work too well in that scenario.
Yeah, apparently not. What about for children, not newborns, for older kids? How about that?
Well, coverage issues for children. There's one other thing I did want to mention with newborns. A lot of times we do see, like, if there's intensive care unit, necessary care for preemies, that's something that there's issues that arise a lot. But a lot of times it's because of those same coverage issues that I mentioned.
Okay.
As far as children, I mean, generally, all health insurance works the same according to whatever policy it is, whatever laws are in place to children and adults. There may be laws that protect children and adults differently, but there really aren't because they're blanket. But I do see a pattern often for children of denials with children with autism in general, because they need a lot of different types of therapies. They need physical therapy, occupational therapy, speech therapy, some behavioral modification therapy. And in that instance, there's so many technicalities that, of course, whether it be Medicaid or an employer plan or regular health insurance, they find some kind of reason to deny the services to these children, which is very unfortunate. But it's a pattern that I am seeing a lot. There are laws in Florida that require employer group plans in particular to pay a certain amount. It's a pattern where they're denying these services based on what medical provider is providing the services, whether they qualify or not, and then basically just the technicalities of the diagnoses and trying to overstep what the actual behavioral provider is recommending. So that is one of the things I see a lot happening with children. There is another one that there is also another pattern of denials that happens very often is growth hormone therapy. So I think as medicine advances, doctors are now able to pinpoint things a lot better and to see if there is some kind of deficit in growth or any type of anything dealing with growth and how the child is progressing through puberty. There's so many advanced ways to look at the diagnoses and how the child is growing. So there's always new medications coming out and new hormone therapies. There's some standard ones. But if there are new therapies, then the insurance companies, again, they say, look, the child has to fit into a box. And if they don't fit our check marks, we're going to deny it. And of course, that's not going to be within the medical standard of care because a child is not a box. They're an individual. But that's one that I often have had to fight for in many instances.
I have a buddy whose daughter had chronic ear infections, and they had to do that thing where they put tubes in there,
Mm-hmm.
and denied. The health insurance company said it was unnecessary. I was like, wait a minute, they have this poor kid, chronic ear infections, so much pain and fevers and all that. I mean, how can they justify denying care, especially if specialists are saying that they should do it?
Yes. So what you just mentioned is actually one of the reasons, like it's not medically necessary, right? So that's like the vague term that they use for everything.
Yeah.
And they just try to find whatever excuse or whatever element within their little box that doesn't fit. And they say, well, you didn't meet this. And they just say it's not medically necessary. And I mean, I do think in the long run, they're just trying to, they're denying claims because a lot of people just don't appeal and then give up. But I agree with you, like the specialist is the one that knows. The specialists are the ones that see the kids. They're the ones that do the examinations. And it's just the insurance company is just looking at the box, the policy, and, their little loophole. What they say is, this doesn't mean you shouldn't get the care. This just means that we're making a coverage decision.
Mm-hmm. Yeah, that's got to be frustrating. I can't even imagine. I know my friend was very, very frustrated because it's like $8,000. It wasn't chump change. So I mean, and of course, also you want your kid to be healthy and not in pain. So
yeah, exactly. For that they just have to keep fighting, do the appeals, and go all the way.
Yeah, that was my next question. So what can parents do to advocate effectively for their child's care when they face a denial?
So the first thing that they can do, like any general health insurance policy, they would do an appeal. Typically the doctor's the one that's going to do the first appeal. They usually send it right away to the insurance company. They get an answer back. And then if they still deny it, then the doctor or specialist would do a peer-to-peer review that is supposed to be with somebody at their own level that has the same specialty, making a decision to say, yes, we're going to overturn it or not. If they still deny it, which at this point, if they are still denying it, it probably is motivated by their financials, not really by the child's well-being. Mm-hmm. At that point, then the parents need to look at the policies, review the denial letter, and then see what the next step in appeal is, because every policy is going to have a different process for appealing. Most of them are pretty standard, but there's typically a first level appeal, then a second level appeal, and then an external review. But each of those levels have different deadlines, so they have to make sure that they comply with the deadlines. And then if it's an expedited appeal that is necessary, they would request an expedited appeal that usually has to be decided in 72 hours. So again, it all depends on the policy, but it is the process to follow that appeals procedure. And then the other thing I want to mention is there's some children that do have Medicaid. So under Medicaid, those rules are different, where typically there are 2 levels of appeal, and then they can request a fair hearing with a hearing officer. In Florida, it's through the Agency for Healthcare Administration. In other states, it's probably kind of the same thing, but in Florida, it is that agency. And then basically you have to go to a mini trial on the phone with a hearing officer that is not a real judge. They're just an attorney that is playing the role of a hearing officer. So that can be a little bit frustrating and burdensome when parents have to deal with this for their kids.
Yeah, definitely. It sounds like a long process too.
Yeah, it is. It is the long process, and it really breaks my heart sometimes because I that's one of the things that I always say yes, like kids with Medicaid, even if they can't pay, because it's a child. So when I see a family have to go through this and, do a little mini trial just because their child is sick or needs treatment, I mean, It's just heartbreaking. They're saying they're following their procedures, but Medicaid is guilty of the same thing. They just say, not medically necessary. The boxes aren't checked, and
Yeah, you
that's
brought up.
unfortunate.
Yeah, you brought up a great point just before. You everybody's an individual. Everybody's different. I mean, we all have, you can't just put, like you said, you can't just have a bunch of check boxes for every person. We're all very different people. So yeah,
Exactly.
it seems like an archaic way of doing things.
Yeah, exactly. And that's exactly what the practice of medicine is, right? Like doctors are supposed to practice medicine and
Right.
not be checking boxes. Like they have to look at the patient, and insurance is slowly taking that away from them.
Mm-hmm. That's not ideal. So how do you work with the physicians to help build a strong case for when a child needs treatment?
Well, so we work very closely with physicians because we collaborate with the doctors for whatever the child needs, because obviously we can make any legal argument, but it's really the clinical part of what the patient needs that matters the most. So we work closely with them. Like if we have to do an appeal, we make sure to get all the medical records from the doctor's office. Sometimes they write letters, or sometimes they sign affidavits or do a review of the case. Or I've had physicians that have even, they've testified in court or at one of these Medicaid hearings to try to help these children get the treatment that they need, or people in general. But it's, we do work very closely with the doctors in those situations.
Can you share a case where legal action helped a child receive care that they really needed?
Well, there's quite a few. I already talked about one in a prior episode. I won't talk about that one, but I guess one of the most recent ones, this one was a Medicaid case, it was a child with a disability that needed skilled nursing services, and Medicaid was denying the services, saying that he wasn't sick enough. And the doctor, I mean, it was a very complex case involving a neurologist, brain issues, all kinds of things. And we had to fight, for months, gathering documents, getting the doctor to testify. We had to go, it was a full day hearing. And at the end, we were able to get it overturned. And the agency in this case agreed with our argument and said the physician was right. All the clinical documentation showed that this child did need that skilled nursing for his well-being. And, this is a 15-year-old child, so it's pretty delicate because of the stage of life they're going through as well.
Mm-hmm.
So that was actually a huge win too, because we helped this family that, if their child isn't getting proper care, then they can't even go to work because he needs to be cared for while he's home. So that's one. Another, there's just been so many. I'm just trying to go over in my mind the ones that I've dealt with the most. Definitely the newborn cases that I talked about earlier. There have been cases for the growth hormone deficiency where we've had to go to court to get that overturned. Most recently, right now, we're working on a little girl that needs a specific type of surgery for her ears. That is a very specific procedure that an insurance company is refusing to approve. Hopefully, we'll get somewhere there, but that's the process. It's just, there's just so many to try to think about.
It sounds like it. Is it hard? Is it hard for you to, I don't know, like it seems heavy. Like, is it hard for you to not get emotionally involved?
Sometimes, yes. But I think over the years, as I've gotten more and more involved, I've learned to just keep my distance a little bit, because sometimes it is hard, if you're seeing a little child suffering and they can't get what they need. It's definitely, it's definitely sad, but I can't get emotional because I won't be able to do my job to help them. So I just I try my best to just focus on the goal, which is to try and to get them the treatment that they need.
Yeah. I can totally understand that. If you get too emotional, then it makes it harder for you to be effective at what you're trying to accomplish.
Yeah.
Yeah.
No, most definitely.
So for anybody listening to our show here who are going through a denial, that feel defeated, that they feel powerless, that they're frustrated, what kind of advice can you give them? What should be their next step, and how can they get help?
Well, the next step, I think, definitely, reach out to an attorney. because an attorney that does this area of the law is going to know exactly what to do and who they need to reach. And if the attorney is known in the field, then obviously the health insurance company is going to pay more attention to it and not just let it slide. So it may have a little more weight. Other than that, working with the doctor's office is always good. If a person has health insurance through their employer, I recommend they talk to their HR department as well, because sometimes the HR department has people in there that help specifically with the health insurance denials and have direct communication with the health insurance company to try and resolve the issues.
Okay, well, great tips for sure. Thank you for tuning in to From the Clinic to the Courtroom, Health Law Unpacked with Maria T. Santi Esquire. To connect with Maria and the team, head to healthandmedicinelawfirm.com. And don't forget to subscribe to our channel. Leave us a review. We got lots more great content coming your way. Maria, so glad to have you here. Thanks so much for all the insight.
Thank you so much for having me.
Thanks for watching. Be sure to hit that like and subscribe button and leave us a review in the comments.